Hello everyone. So we are back with another case. When you look at the photo on screen, you would understand that the patient would have come here to get the spaces closed. And exactly that is what the patient was here for. Look at these pictures. Clearly, you can see that the space between his centrals would be at least some 6 to 7 mm. And he also has open bite, which would be some 4 to 5 mm. And also the proclination of teeth. Now, looking at all these things that the patient has, also he has all this calculus present, which was not the patient's concern. Patient was concerned about the spacings, especially in the upper central region. So, looking at all these clinical findings, the treatment or the ideal treatment for this patient would be orthodontic treatment. But patient had no budget for that and also no time for that. Patient was going through some matches. He was looking at some alliances, so he didn't want to spend more time in the clinic, or he neither has that time to actually get the orthodontic treatment done. He wanted a fix within 2 to 3 days, and also he wanted it more affordable. So what did we do? All that we did was to give him an RPD. Look at this picture. You'll be able to appreciate this area, which shows you the acrylic or the pink acrylic part, which gives you an evidence of denture. So that's what we have done. We have given him a very simple removable partial denture, which added a tooth in between that space. That's it. No complex treatment, not time taking, and not expensive also. We satisfied all the criteria for the patients. We gave him a quick fix and also affordable fix, and also we cleared the space in between. So sometimes we might be looking at a case in a very complex way that the patient might not even be expecting it to be that complex, and the patients might want a very simple fix for them, very simple solution for them. All that we need to do in those times is to just give our ears to the patients, listen to what they actually want, and give them that very simple solutions that they need. That is all we have to do. Look at the difference between these pre-op and the post-op pictures. So that's how much of a difference a very simple treatment can make. And also one more thing that has really favored us in this case was the midline. Definitely, I have no doubts about it, because when you look at his midline, that's almost deviated towards the right side. Almost his midline is in the center. His central or the pontic, whichever we have placed, is almost following into the midline, so it does not also give a very odd appearance to the patient's dentition. So that also definitely played a key role in doing this treatment and not making the patient look odd, because when the midline shift is there or when there is a missing midline, that might be noticeable. Of course, that's noticeable to dentists, but for the common people also that might be noticeable in sometimes. But in this case, there's no fear for that also, because the midline was a little deviated, and which gave the pontic an appearance of midline. So that's it for today, guys. Meet you again with another video.